Hello, and welcome to the Health Go Live webinar series. Today's episode is brought to you by your friends at Carrot Fertility. We would like to remind you that the Q&A feature is available, so feel free to send in your questions for the panel throughout the discussion. And with that, I will turn it over to our moderator, Jackie McFadden.
Hello and welcome everyone. We're excited to have you be part of this webinar today. We have an exciting lineup of expert speakers today and bringing you some amazing information in this space. I'm also the lucky one that gets to moderate today, so I appreciate you spending the time with us. So the title today is Leveraging Clinical Expertise to Improve Fertility Outcomes. And the clinical expertise today, we have two amazing speakers. First is Dr. Asma Ahmad. As a Chicago-based reproductive endocrinologist and infertility specialist, Dr. Asma Ahmad is highly skilled in all areas of reproductive health. She's passionate about helping people build the family of their dreams, especially when care includes accessibility to fertility treatment, polycystic ovarian syndrome or PCOS, ovarian reserves, minimal stimulation and natural cycle IVF, and genetic testing. Also joining us today is Dr. Javine McLaughlin. She is a Senior Director of Medical Solutions at Carrot Fertility and a board-certified obstetrician and gynecologist. She's been part of many family-forming journeys throughout her career and has a passion for healthcare, fertility, and wellness for all. So just a little bit on why we're here today. We know that health plans are facing complex challenges in the fertility and women's health market. These issues are becoming more common and more costly. All the while, demand is not slowing down. We see that 1 in 6 US couples are affected by infertility, a rate higher than diabetes. And 61% of employers say they cover or plan to cover fertility services beyond a diagnosis of infertility. The time is now to address gaps and enhance benefits to truly make an impact. Historically, fertility challenges have been a taboo subject, and that's changing. People are becoming more comfortable about sharing their personal stories. And so that's actually where we're gonna start today. I'm gonna first start with Dr. Ahmad, a question for you. And I'd love to get your thoughts on breaking the stigma of talking about fertility.
I think that's a very important topic, actually. And I think it goes back to one of the statistics that you mentioned, right? So that 1 in 6 people globally have infertility. And I think that it's important to recognize that the prevalence is so high. Now, one other thing that you mentioned was that people are sharing their stories more. And I think that's really important because I see this in clinic a lot too, in that when people finally come into the clinic to seek care, for many, they've had a delay. And the reason behind that is because of the stigma around the topic of fertility. For many of them, they've hesitated to discuss it with their partner or even with those individuals around them, like their support system. And because of that, they've also been hesitant to step into the clinic and talk to a physician and seek care around it. And the other thing that I've also seen, and I think that needs to improve, is what I would like to say is like dismissive behavior around the topic of fertility. In many instances, someone may say that, I've been trying for a year and I'm not getting pregnant, or I have irregular cycles, or I've had 3 miscarriages now. And in many instances, they're told, you know what, don't worry about it. Why don't you keep trying? It's because you're stressed out. You're having regular periods because that just happens. You don't need to do anything. Just give it time, wait, and eventually you'll have that baby that you're hoping for. And again, I think that those things result in a delay to care. What that does is it adds time, that increases age, and all that also impacts outcomes. From a personal standpoint, I have polycystic ovary syndrome or PCOS. as you mentioned as well. And for me, I've always had irregular cycles. So I'm one of those stories where I had irregular cycles. I talked to many people, whether it's providers, support system around me about it. And I was lucky that I did have someone in my family that helped me seek care early on. But again, when I walked into the office, I was told I was very young, not to worry about it, and just keep moving on. And the short version is that eventually I did do the workup to determine that I did have PCOS. And that was because I was proactive about it. I had learned about it and I sought out that care. I need to do an ultrasound. I need to do these tests. And in a way, it was a self-diagnosis and then confirmed with my provider. But that's something that we want to prevent from happening. And by reducing the stigma, by reducing this dismissive behavior around the topic, that's how we can improve care around this topic.
Excellent. Thank you. And thank you for sharing your story as well. So we'll move to the next question. I'm actually going to give this one to Dr. McLaughlin, and I'd like to talk about the topic of education a bit. Specifically, why is fostering health literacy and pre-pregnancy education so important?
Thanks, Jackie. It's such a great question. And, we talk about prenatal care and even preconceptual counseling and all kinds of education opportunities. And sometimes I think it's hard to understand why this is so important. And so I think, talking about personal stories, I think I'll tell one of my own as well. I've been working through a journey right now of helping my mother, who unfortunately was diagnosed with breast cancer, and helping her navigate the entire medical field and all of her medical appointments. And what was very intriguing to me is that, we've had these wonderful providers who have just done this excellent job of helping understand and answer questions, and some office visits even lasting an hour or more. And despite that, by the time we got home from visits, there would be so many questions, and many of which were answered in the office or were answered prior. But those answers were at a time when there was so much emotion and such a high emotional state going on for my mother. And I see this with my own patients. I'll often say, can you bring a friend or someone you love with you to the appointments? Because unfortunately, when you're in this heightened emotional state, which is definitely what happens with fertility and definitely what happens with pregnancy, sometimes you aren't able to capture everything that you get during that visit. And so this is where education really comes in. Sometimes it's just about being able to find a spot where you can re-ask the same questions, or look a little more in depth into a diagnosis you've been given, or understand something a little bit more. To Asima's point, if you've been told about PCOS, then you want to make sure that you understand, what does this mean, and what does this mean for me? And so I think we really need to focus on being able to find a safe and educated place for people to find this information. And so there are so many places people can go reach out to, and some of those are great resources, and some of those are unfortunately sources of misinformation, and they don't lead to better understanding and better ability to really help advocate for yourself as well. So I think that's very, very important.
Great. Asima, could you discuss maybe a little bit on a little bit to add on to education? Could you discuss a little bit about additional supportive care and even group support as part of the education?
Absolutely. So there's different types of supportive care, for example, emotional support. But in terms of group support, I can address that maybe more in terms of prenatal care, and then we can go from there. So there have been multiple studies that have looked at group prenatal care and what sort of impacts they might have on pregnancy. And they've looked at different populations as well, different types of studies, observational studies, for example. So the most data that I see is around special populations. For example, if you look at Black women, low income, you can see that there is a reduction in preterm labor for that population. Other changes that we've seen throughout observational studies around group care include, for example, improved outcomes for the baby, for example, increased birth weight. There can also be increased initiation and continuation of breastfeeding. For the individual that's pregnant, improved knowledge of the childbirth process, increased knowledge around postpartum emotions, for example, postpartum depression, early child care, as well as reducing the amount of emergency department or urgent care visits in the third trimester, so later in pregnancy. And what we also see is a improved satisfaction for both the patient as well as the provider. Again, these come from observational studies, so we see mixed results with some of this, but we can see that there are some positive impacts that can come out of the experience of a group session. And I think that that's because there's like, as you mentioned, a support system that forms around it. You have other people going through the same journey who might be going through something similar. I don't know about you, but when I was in school, sometimes if it was a question that I was a little nervous about asking, but I was in a group of similar people and they happened to ask it, it also helped me out. So in a similar method, right? If someone's having irregular contractions and someone else happens to ask about it, it may also address the question that someone else was a little hesitant to ask. So there's definitely some positives that come out of that. And I don't just see that when we think about pregnancy. I also see that with some of my patients who have other diagnoses. For example, I've had women reach out to me who have early onset menopause and ask me if I know of any groups or community support sessions that they can join so that they can discuss what they're going through with other individuals who have similar symptoms or similar experiences and understand what their coping mechanisms may be. Because in many situations, that diagnosis might be taking an emotional toll on the person, and this can help them get through it. So definitely some benefit for, both when it comes to emotional supportive as well as outcomes related to group sessions.
Yeah, absolutely. It's amazing the impact that the peers can have on each other, as part of that process and that support. That's definitely true. Something that Javine, you said earlier, I kind of want to go back to that if you don't mind. You use the word misinformation, and I'd love to go back to that and just ask you to maybe elaborate a little bit on the sea of misinformation that could impact a patient's journey.
Yeah, sure. That's a great question. I think what we have to look at is, where do we get information today? You can ask your friends, you can ask a neighbor, and then of course there's, TikTok and Google and social media and whatever avenue and search engine you like to use to try to ask a question. The unfortunate thing is that if you ask a question of a search engine, it's going to find an answer. It doesn't ever come up and say, there's no answer for this. It gives you an answer. And depending on how you ask that question, you may get an answer that has a lot of validity, has a lot of great information in it, or you may get an answer that has absolutely no evidence base or no knowledge that actually is going to help you on your journey. And how do you know? How do you know what you're getting? So we talk about evaluating the source and all kinds of things that we teach our children about how to analyze whether what you're getting is the right information. But in medicine, this can be really difficult to do, even for some of the, most prolific researchers. And so one of the things is to find that trusted source where somebody's done the work for you and can give you the information that is coming from a safe place, is evidence-based, and is really there to support your journey with information that is real. And so it's helping you weed through this big sea of information and find that ship that I'm going to be safe right here if I just ask in this spot or ask this area. And so having a place for every patient to be able to go to is just an incredible resource. And so this can happen in, one-to-one chats. This can happen in a group setting. This can happen in all kinds of avenues, whether it's literature you're reading. You just need to find a place where you can trust where that information is coming from. And I think that's just so important in this information age.
Absolutely. I can relate to that, and just looking up information about anything, medically, clinically, it can be a bit overwhelming, and you can go down a rabbit hole even as well. So having a more focused and true source, I could see the benefit of that for sure. Well, I'd like to talk a little bit about, next step beyond education, and more about moving into the care that a patient starts getting, specifically with providers. And so I'd love and I'm not sure if Javine, you want to take this, or Asima, you start, but I'd love for you to talk a little bit more about the importance of specialized care and providers.
Yes. So getting into the clinic or even the virtual telehealth appointment in a timely fashion is of utmost importance when it comes to fertility. I'm sure many of the members of this webinar know that age has a very strong impact on fertility. So time is of the essence. And so getting into that, to see that provider, talk to that provider, may have an impact on your ability to grow your family, depending on that time range that it took. So having access to a specialized provider in a timely fashion is extremely impactful, I would say. Now, how you access that care can vary. So in some instances, it can help to have a virtual session. For example, sometimes people are unable to get into clinic in a timely fashion because they have work or home obligations. They can't find a babysitter. They can't take the whole day off from work to drive like that hour to the clinical setting. And so virtual one-on-one sessions allow people to get that care sooner in many cases. And it's important to, in that setting, also have access to different types of providers. When we're thinking about pregnancy, for instance, I think about pregnancy as not just the one provider, but a team of providers that can help improve outcomes together. And so that can include doulas, midwives, lactation consultants, nutrition experts, etc. But again, in addition to that telehealth and virtual support, it is important to be able to get into the clinic as soon as you can for that in-person care that's necessary. So you can't do everything virtually, unfortunately. So, blood draws, ultrasounds, procedures, those are all, take place in person. So it's important to be set up with a provider in a timely fashion, but also someone that you feel comfortable with, that understands where you're coming from and can provide culturally competent care. So it is important in many instances to be able to match a provider with that patient that may come from a similar background, for instance, to be able to provide that care, and or someone who really understands the background of the patient and that can address those issues in a good manner. And I think, again, this is something we do at Carrot, is that even when people are proceeding with their care with their clinic or, whether it's fertility clinic or OB provider, we still have that continued support to address what Javine said, because in many cases you go into the clinic, it's overwhelming. You forget the questions that you wanted to ask, or you did ask them and you forgot the answers. And so you can have this continued support available with unlimited sessions that helps to fill in some of those gaps and or readdress things that maybe you might have forgotten or have forgotten to ask.
Right. I love that answer. And I think, it's so important that we are that we are a space where you can get before and after visits. To my, personal story, sometimes even just getting that list of questions together. So sometimes it's just, I don't even know what question to ask. And so sometimes that discussion helps give you those questions so that you can prepare better for that visit with your provider and get more information out of the visit even beforehand, as well as help you understand afterwards. So I think that's just, really, really important to focus on.
Great. Well, thank you both. We spent some time talking about, breaking the stigma and talking about these things. We talked about the importance of, education as part of the process and empowering patients to get the information they need and also get the right information they need because of everything that's out there today and sifting through all of that, which can be very hard. And then, of course, the importance of a provider and getting that specialized care. When we look at all of those things and tying those all together, how do we show the value of this? And how do we truly move the needle from an outcomes perspective?
I would say it's important to have clinical support that's driven by experts and have access to that specialized care so that you can reduce risk, you can reduce cost, and thus you can also improve outcomes. I think it's important to have a system in place that can have early identification of risk so that measures can be made and you can partake in risk reduction methods to then again improve downstream outcomes. I think it's important to think of cost-effective methods for treatment because again, it's not a one-size-fits-all. We say that all the time. And think of less invasive options that may help someone reach their, whether it's fertility or family building goal or, other healthcare goal, and do that in a way, again, that reduces costs. And I think one thing that we at CARE we have top of mind is just equity and culturally competent care. With everything that we build, with everything that our members touch, we take into consideration regional, cultural, religious, and legal variations. And from day one, we've always thought about being inclusive, not just domestically, but also globally. We've always had this global vision and about supporting all paths to parenthood as well. So I think that having a global vision of equity, inclusion, as well as methods, to continue working on risk reduction and cost-effective methods can be helpful in this manner.
And thank you. Well, I know I've been asking all the questions. I want to just take a moment to remind the audience to please submit some questions using your, take a moment using the Q&A feature within Zoom. And I know that we do have one. I'm going to start there, but if others, please submit them as we go along, and we'll get to those next. But I do have one from the audience, and the first one that I'll first I'll start with maybe Dr. McLaughlin. We'll start with you on this one. I think this would make sense for you. How do maternity benefits support health equity and the work that health plans are already doing?
No, that's a great question. I think partnering with the right maternity solution allows, a health plan to kind of offer a comprehensive approach to maternity care. You can engage members on every component and every part of their unique journey. I think it's really important to understand that everyone has a different journey, and even the same journey looks different for every single patient. And so whether this is pregnancy, family forming, any other maternity healthcare challenges, they need to be met where they are in that moment and what they actually need from the product. Most significantly, these maternity benefits can bridge the gap in maternity care, We can offer culturally competent care in the sense that we are, trying to, again, meet the person where they are in their journey and what is specifically needed for them. It's important to know that, I think Dr. Ahmad mentioned, when a patient and a physician share the same race or cultural background, there's research to show they have higher patient satisfaction scores, and that will improve outcomes and help them take their medication on time and do what the recommendations are for medical treatment, and will end up giving you better outcomes overall, and hopefully improve the quality and the satisfaction with how that entire journey went from start to finish and beyond.
Excellent, thank you. We do have a few more questions coming in too, so I think you sparked a few more areas. So the next question, and Dr. Ahmad, I'll start with you on this one, and it's about matching members with providers. So how do you match a member with a provider? What factors are included other than age, language, condition, etc.? Is there more to consider when matching?
Yes. So to start, I think the biggest, most important thing is, what is the person or the patient looking for in their provider, right? In some instances, it may be important for them to have the same cultural, maybe religious, race, ethnicity, or maybe even sexual orientation background, and they can specify that. In some cases, it may be the opposite. They may say, you know what, I'm of South Asian background and I don't want a South Asian provider. But I think when it comes to matching and the data that we've seen around that, in many cases, it'll include those components that were already raised in the question, in addition to the ones that I mentioned.
Great. All right. I have another question around, I shouldn't say another, but a different type of question around leadership training. So they specifically ask, how important is leadership training to progressing the conversation? So maybe getting more to breaking that stigma. How important is leadership training in that and progressing that conversation and supporting employees with these issues that sometimes seem invisible?
It's a great question. I think, leadership training is immensely beneficial. I think that the more awareness there is, the more that this becomes a discussion point and people actually talk about it, the more we can address these issues. And so leadership training is a huge component of helping leaders understand how to open those doors, how to open those conversations, and how to support. And so I would say this is a critical component for any company and a big part of any sort of diversity, equity, and inclusive environment. And so I think it's very important.
And just to add on to that, I could add, I've worked in, implementation a lot throughout my career. And one thing we found also beneficial is just having specific leadership packets, webinars, things around that, so that the conversation can be different. It's more at a leadership level and how to navigate that. And specific to Carrot too, whenever we roll out the benefit, having a separate leadership introduction and support and FAQs around this has been beneficial as well.
And I think that partnering with a product that is really embedded in this helps as well, because I think you see it in everything that we do here at Carrot.
All right, I have another question around, and I think maybe Dr. Ahmad, I'm gonna give this one to you. I've just, it involves doulas, and I've heard you speak to doulas quite a bit. So I'm gonna start with you. Have you looked at specific interventions, for example, birth, doulas, maternal centering, to help promote additional support?
Absolutely. So I did talk a little bit about, centering in pregnancy or group prenatal care, but I'll touch a little bit more on the doula component. So there again have been studies that have looked at the impact of doulas and pregnancy outcomes, and some of the data has shown that it increases uh, the chance of a spontaneous vaginal delivery, decreases, for example, instrument assisted vaginal deliveries. It can also result in a increase in APGAR scores, or even the feelings around childbirth, a reduction in analgesia use during the labor process. So there have been positive things that have been shown around use of doula in pregnancy, but doula, when people think of doulas, they traditionally think of the labor experience. Doulas aren't just there for the labor and birth process. They can be utilized throughout the pregnancy. They can come with you to your prenatal visits, as Dr. McLaughlin had mentioned. Sometimes having someone there and being your support, or being that person that comes back home with you and then goes over the topics that were discussed during the prenatal visit, can be helpful. So they can do that. They can be there as well postpartum. I actually used a postpartum doula for the first time. It was my fourth child, and I found it extremely helpful. Very supportive from like a lactation and just like personal support standpoint. And they can also be used in journeys of fertility, as well as, in the situation, unfortunately, of pregnancy loss. So there are many uses or use cases when it comes to doulas that can show like a benefit. But some of the things that I mentioned about pregnancy and doula and pregnancy outcomes, there have been some improvements in there.
Oh, that's great. And I'm glad to hear your experience, that with your doula, with part of your fourth child. I actually, just on a side note, a good friend of mine was not part of her plan to use a doula, but COVID introduced the need. It was kind of, she couldn't have family with her in the delivery room, and she opted for a doula. And she's wished she would have from the beginning, just the amount of experience and support that they gave her. Her third child, she opted for a doula from the beginning. So very beneficial.
I think I'll just add to that too, that I think, we hear about birth trauma and traumatic experiences with the birthing experience, and sometimes a source of fear for some people as they go through the birthing process. And doulas really can impact the ability to create a flexible plan, and the ability to anticipate all the things that might happen, and to feel like there's someone there really to support you the entire time. And I think that's a huge component of decreasing that potential. So
it's a great point. Yes, we can't say enough the great things about doulas here. So I do have another question. It's switching to the topic of in vitro fertilization a little bit, and it's around possible fast tracking, to a procedure like in vitro fertilization. But how do you safeguard against that? So someone's not, fast tracked to IVF or in vitro fertilization when it might not be medically necessary.
Yeah. And I think that last part you said was very important, because in some cases it might be medically necessary and you should fast track to IVF. So an example of that might be someone who has blocked fallopian tubes, or where, the partner may have low sperm counts, and they've tried multiple treatments, but the numbers are still too low for an intrauterine or an IUI, IUI to be successful. So I think that in those cases, yes, fast tracking is a great idea. But I think in many cases, there are options that you can do before you get to that point, right? So for example, someone who might have what we call ovulatory dysfunction, doesn't have predictable ovulation. And when it comes to timing intercourse, that egg only lasts 12 to 24 hours. So you have to time things in a manner where the sperm and the egg can meet. And so with unpredictable ovulation, for some people, it may just mean something that's a little bit easier, a little bit more cost effective, like taking a medication such as Clomid, clomiphene citrate, or letrozole. And of course, monitoring, seeing how their response is, making sure they're ovulating, and then timing intercourse accordingly. I mentioned the IUI, that can also be something that can be used before getting to IVF. I think what's most important is recognizing what the issue, like getting a proper diagnostic workup, recognizing what the issues are at hand, what your diagnosis is, and what your treatment options are, and having the option of doing things before IVF, like you said, when medically appropriate. And we do find that there are many individuals that are interested in that because IVF in general, like let's say someone was paying out of pocket, can be very expensive. It's also more invasive. You generally, you do undergo anesthesia to be able to do the retrieval. So there's that aspect as well. So I do think it's important for people to have those options. And I think one way to do that is to educate them upstream, right? Educate them about what's available, educate them about the questions that they should be asking their provider when it comes to their diagnosis, what their options may be, knowing what those success rates may look like, and then from there making an informed decisions. And I think it's also, the other thing about like the education piece is also being informed about your fertility. And that can be through, for example, at-home testing or using devices or ovulation predictor kits and such, those things at home. For some people, even starting there can be helpful with, again, timing intercourse and getting pregnant.
Sorry about it. Thank you. I was muted there. Well, this might be our last question, but unless we get additional from the audience, I would invite you all to please submit your questions in the Q&A feature of Zoom. But I have a question around, well, when it comes to in vitro fertilization, we hear a lot about, many have twins or many have triplets. And when it comes to possibly having multiple embryos transferred in a result of having multiples, could you speak to, and I guess, Dr. Ahmad, I'll point this question at you. Could you speak to the importance of education around one embryo or single embryo transfer when it comes to fertility treatment options, especially when we're talking about outcomes?
Yeah, very, very important. And I say this because it's still the case that when I have someone come see me in clinic, that one, like let's say it's a couple, one of them, whether it's the husband or the wife, one of them will be like, well, we don't mind having twins, or it would be great to have twins. And then I have to have that conversation as, it's why twins are not the thing that you should be hoping for. Now, in some cases, you can't preventative embryo splits into identical twins, like that was going to happen, right? That you can't really control. But what I tell them, and what's really important is that singleton pregnancy is the healthiest option for the pregnant person and for that baby. When you have a multiple gestation pregnancy, whether that's twins or triplets, quadruplets, that increases the risk for both. That increases the risk for preterm delivery. It increases the risk for C-section, and even, the increased risk, for example, for the pregnant person to have preeclampsia, right? So there's many things that increase there and not in the positive direction. And therefore, I think when they have that background education about why a singleton pregnancy, which is usually achieved with a single embryo transfer, is very, very important, that leaves more room for that provider in the clinical setting to discuss other things that might be of importance to their treatment and their protocol. And I feel that in most cases, when they do come into the clinic with that education, that they they're actually excited about the fact that they might have a singleton pregnancy, as opposed to me talking them down from a twin and telling them, no, like, you shouldn't hope for that. So I think having that education even before coming in is extremely important. And then from a clinical standpoint, having that singleton pregnancy is important both for that pregnant person and for the baby.
Yeah, I couldn't agree more from a pregnancy standpoint. It's like having, the best partner in the room, because it's just this holistic approach when, everyone is thinking of all the parts and what's going to happen downstream from these types of transfers. And so, making sure that pregnant person is taken care of from start all the way through the end of their pregnancy is really so important.
Jackie, you're
You're on mute.
I believe this ends our Q&A session. I'll give one last call to the audience, see if we have anything additional. We've had amazing questions so far, so thank you, everyone.
Thank you.
Well, I think this concludes our session today, our webinar today. But if we do get any additional questions, we can definitely follow up after. With you all. I'd like to thank Dr. Asma Ahmad and Dr. Javine McLaughlin for your input and conversation today. I appreciate it, and thank all the attendees for your time today. Have a great afternoon.
Thank you to Carrot Fertility and to everyone that joined us today. Please visit our website at hlth.com to catch up on all Health Go Live webinars. And join us in Las Vegas, October 8th through 11th for Health 2023.